Welcome to Morning at NTV. This is Everyday Life. My name is Idris Matu and Happy New Year. It's 2018, new resolutions, new plans, forgetting about 2017 or remembering what you didn't do in 2017 and making sure that 2018 is a better year. Now, Uganda faces a high burden of TB, which we call tuberculosis, but accurate estimates of the burden of TB in the country were unavailable. And so a national prevalence survey was therefore conducted from October 2014 to July 2015 to achieve the primary objective of estimating the prevalence of bacteriological confirmed pulmonary in the population aged 15 years in Uganda. Now, there's a lot of words, but I have an expert to explain everything better. And in studio, I have Nora Oaraga, MD of SIPA Uganda Limited. Miss Nora, you are welcome.
Thank you, sir.
You look lovely.
Thank you.
And African. 2018, or has it been from 2017?
I think it pretty much always. I'm a Pan-Africanist.
So, SIPA Uganda, what's that?
SIPA Uganda is actually a not-for-profit development organization that is fully owned by Ugandans. It came into being from growing from an international organization, the Canadian Physicians for Aid and Relief, but in Uganda it is now an indigenous organization. And most of our operations are in northern Uganda, Acholi, Lango, and we hope also to branch into Teso and Karamoja soon. Our work is in healthcare in two perspectives. Previously we were focused on working in terms of curative healthcare, where you provide hospitals, you provide Medicare, you provide staff and that kind of thing. But recently now we are very focused on what we are calling preventative healthcare, where you look at what can prevent illness so that people are not getting the illness and then you
then running to hospital.
Yes, and running to hospital. So the areas for preventative healthcare include food security, food and nutrition security. So we have a whole programming on food and nutrition security focused on using our own indigenous foods. If you feed well, you are less likely to get simple diseases. And then there are also other diseases for which even if you feed well, you can get them, like tuberculosis, which is an airborne disease. So how do you prevent such diseases? You come out and do policy advocacy. You do advocacy and get people to understand that those diseases exist and this is how you can stop yourself from getting those diseases.
Well, TB, as most of us know it, which is tuberculosis. In Uganda, not so many people are aware. And I understand you did a survey.
Yes.
What was the survey about?
Actually, SIPA Uganda did not do only a survey. Following the national TB survey, which you have just referenced, we did an empirical study to investigate what are the impediments that are stopping us as a nation, which has such a high burden of tuberculosis, from having the cutting edge diagnostic services so that people are able to go and be diagnosed to confirm whether or not they have TB. And so we wanted to know what are those things that are causing us not to have this diagnostic equipment. And so that is the study that we did. And the study was codenamed Tuberculosis Working to Empower the Nation's Diagnostic Efforts. And so our study really is feeding into the national TB survey, which say that actually 87,000 cases of TB annually come up in Uganda. 87,000. And that is
Is that in the country or
in the
Kampala?
country? Now, the prevalence rate means that for every 100,000 people, 253 are infected with this airborne disease.
Oh, wow.
Yes. So that is what the national TB study found out. And so we are saying, well, if we have such a high burden of TB, what is the capacity of Uganda as a nation to address and manage that? And as you say, we are not aware. So we are sitting here and many of us are not aware that we actually do have this disease amongst us.
Well, if you have just joined us, I have Nora Oaraga from SIPA Uganda. We are talking about TB, tuberculosis, and there was a survey that was done and found out that 87,000 Ugandans have been diagnosed with TB now.
Annually. That is annually.
Yeah.
New cases annually.
This is a serious disease. so many of us might not be aware that anyone can get the disease, and this is what we are talking about. So please be attentive. Now, after the survey, we found out that the disease is out there to grab people's lives. What has been done?
Okay, so our findings, our study, we conducted it from 2016 to 2017, and the study we interviewed, we had focus group discussions, we had what we call high-level policy dialogue workshops, and then we also had our own survey, which was conducted online. And for Uganda, for the qualitative study for Uganda, we had a total participation of 301 people. And those 300 people were all high-level executives. You have chief administrative officers, you have district health officers, you have RDCs, you have LC5 chairmen, you have technical people who understand the disease. And when they speak, they necessarily are also speaking for the constituency that they represent. So those people gave us the realities on the ground now. And our realities on the ground do not differ very much from also the finding of the National TB Survey. And one of the major findings, for example, is that if you can imagine, in 2016, the budget, I mean the 2017-2018 budget for what you call the Uganda National TB and Leprosy Program, 71% of it is currently unfunded. Now, if 71% of the National TB Program is not funded, how are people going to know that we have this problem?
Hold on. 2017-2018 budget for TB and leprosy.
And leprosy program is not funded.
71%.
Yes, according to the published report of the World Health Organization, 71% is not funded. And this is consistent for Uganda. For Uganda, it has been consistent. If you look at all the national TB reports that are published by the World Health Organization, consistently the budget for the Uganda National TB and Leprosy Program is not covered.
And the 21%?
The 21%, most, and that is another thing, Ministry of Health also will confirm this, most of the funding for tuberculosis is coming from external funding sources. And yet tuberculosis and Ebola, the difference is only in terms of the speed at which the disease will kill you. But in terms of being highly infectious, both diseases are very highly infectious.
And lethal.
And lethal.
Yeah.
And then when you look at the situation in the country, the approved high-tech technology for quickly diagnosing tuberculosis is called the GeneXpert machine. In Uganda, the ratio of GeneXpert machine to the population is 1 to 353,000, our finds. But also that is just counting the physical machines. But if you look at the machines in terms of being functional, because the machine can be there, but it is not functional.
Yeah.
The ratio the ratio can even go higher.
Yeah.
And so we really do have a crisis where people who potentially have TB or are suspected of having TB have no way of confirming that they have TB. And even sometimes, if they make the effort to go and confirm, the costs are high. So if the only machine to confirm whether you have TB is in the district headquarters, you can imagine coming from your rural village to go all the way, and you are already sick looking for these services. So very many people are not going to get tested for TB, and that is a problem, because if you're not tested for TB, it means you stay in your family and in your community infecting others.
Well, we are talking about the lack of awareness amongst Ugandans about the disease. Since so many people are unaware, can you tell us about the disease TB? How does TB how is it spread, number one, and what are the symptoms?
So for example, tuberculosis is an airborne disease, meaning that I can infect you just by you breathing in the air. You know, so the particles come through the air. And so if the particles become concentrated within the same air space in which we are breathing, then you can't get it. And so it's an airborne disease, and one of the ways to avoid that is you will see that people are then encouraged to have rooms which are aerated. So if a room is not aerated, like a bus, If you take a bus all the way from, say, Gulu to Kampala, you're sitting in it for how many hours? And the
Over
windows
8
are all
hours.
closed, and you are cramped in one space. So you can imagine you are all sitting next to each other and you're cramped.
Yeah.
The chances that you get tuberculosis while you are in a bus traveling are very high.
So it's advisable whenever you are in a public means of transport to make sure that the windows are open?
It's quite advisable, but
Yeah.
sometimes we don't want to open them because it will destroy our hair. But so it's quite advisable.
Okay.
But also, TB can be transmitted through the liquids.
Yeah.
So saliva and the liquids, sputum that, so if you share cups, share utensils, and you have TB and you share them, you understand, you
Share
can
a
get
cup.
yeah. Share a cup, those liquids, you can get infected. And so that is why, for example, when someone has been confirmed to have TB, part of the prevention or the treatment is to separate this person's utensils in the home.
How can I tell that someone has TB?
One of the signs that someone has TB is coughing. That is the most common one. But you see, the problem is then that you have the ordinary cough. So many people who have TB will first cough
For months.
for months until they begin to cough blood,
Yeah.
or until their internal organs become like really, really burdened. That is when they now start seeking Medicare. And that is where we have a problem in Uganda. Because when people start coughing, the immediate reaction is not, let me go and check if this is TB. The first port of call, unfortunately, is to go and self-medicate
Yeah.
off the counter. So if they self-medicate off the counter, they will go for the scientific Western medicine, syrups and what antibiotics. Then that will mask the disease. Sometimes you feel a little bit better, but the disease is still in there and you continue to be infectious. But the worst kind is when these herbalists start telling you that I can cure that cough. And so people get involved with these herbalists, wherever. And so it is now our study finds, CIPA's study finds, that by the time people are actually now going to start to the doctors
Treat.
start to suspect that this might be TB, it is in advanced stages. It has caused significant damage to the lungs, and so the person now comes when they have lost weight. That is also another sign of TB. Lost weight, they are fatigued, they have also temperature, night sweats, like you have fevers and night sweats. So by the time someone actually now goes to test for TB, they have had it for a long time, and it has really, really sort of taken a toll on them.
I've had also loss of appetite.
Loss of appetite. Loss of appetite is one of them. So there are the similar factors that might come, say, with HIV and AIDS, or sometimes also which might come with ordinary cough, are the similar factors. And actually, unfortunately, that is one of the challenges with TB, because then HIV and AIDS, when it came, many people might even think that they are now
Associate.
HIV and AIDS positive. So there is a big association with HIV and AIDS and TB. And unfortunately, even though Uganda is really considered as one of those countries that has succeeded in fighting stigma, stigma for HIV and AIDS is still very high.
Well, if you have just joined us, we are talking about TB and its awareness. Now, so many of us are not aware what are the symptoms, what causes TB, and how is it spread, and how can we avoid it. We are talking about it with Nora Oaraga, MD, CIPA Uganda, and we are saying go and get tested and be sure that either you have TB or not. When you get a little bit of cough and you think you're going to self-medicate, that might be a digging of a deep well where you will not get from. Now, Nora, we were talking about how so many people associate TB with HIV. And probably certain people don't want to go and test for TB.
Yes.
Because they think the moment I have TB, I am dead.
Yes.
Tell us about that.
And actually,
Is it necessarily that TB and HIV move together, or is it a different story altogether?
the unfortunate situation is that people with HIV and AIDS are more likely to contract TB as well.
And why is that?
Because HIV and AIDS, your immune system is suppressed. That is what HIV does. And TB is a highly infectious disease. So if your immune system is weak, the chances are high that you get tuberculosis because your immune system is weak.
Low.
So the people in Uganda who contract HIV die earlier or quickly, not because of HIV per se, but because of what you call the opportunistic diseases. Malaria, tuberculosis has now become one of them. Because if you are HIV positive and you don't get malaria, you can live much longer.
What causes TB?
TB is caused by a bacterium, Mycobacterium. And actually, all of us have TB somehow, because remember, we are vaccinated as children. We are given that virus to shield us from getting TB. So the active TB is the dangerous one. So what triggers it to become active in your body is very technical scientific stuff. I am a cultural anthropologist, remember. I am a cultural anthropologist. But basically, just to know that there is a bacteria that will cause TB. So it's a bacterium that causes TB.
So is anyone susceptible to acquiring the disease, or particular things have to be done to make sure that you don't get the disease? Is that
all of us are at risk of getting the disease, and that is why we must take all the precautions not to get the disease. And one of the precautions are that medical personnel who are receiving patients must protect themselves always. So, for example, at the point of doing what they call triage, you know, at the outpatient place, when you come as a patient for the first time, ordinarily, medical personnel should have masks or handle with gloves, just like with blood, how you protect yourself with needles and whatever. And so if you've then discovered that somebody has TB, you must take all the necessary precautions not to be in a closed space with them. I mean, like even husband and wife are recommended to separate their bedrooms for the time they are treated. The good thing to remember, though, is that tuberculosis is unlike HIV and AIDS. It is treatable. It is treatable, it is curable, and the government of Uganda, by the way, is providing free diagnostic services and is also providing free Medicare. You don't actually have to pay for diagnostic services when you reach a health facility of government of Uganda. You also don't have to pay for the medication. But the challenges become when someone has to travel long distances to go
access these health services.
And also the challenges is if the only machine in covering a geography of an entire region is not functioning. That's where the challenges come. And that is where our policy advocacy is coming. And we have submitted a policy brief to the Health Committee of Parliament. And we are asking them to please look into the issues of funding TB, number one, but also look at the issues on if the funding is allocated, that it actually gets there, that it is not diverted, and that TB is given the same priority as Ebola is given. Do you know, by the way, that Dr. Lukuya, if you remember him, who died from getting infected with Ebola, got infected because a study shows that he was overworked, he was tired, he was the only doctor, I think, on call at that time. They woke him up to attend to somebody. He forgot to put on the mask. And then he contracted the disease. The same issues that the doctors have been striking about become extremely important when you contextualize their working conditions within also highly infectious diseases like tuberculosis. They are the same thing. And so we are saying we need as a nation to look at that, but not only government, even us here in the private sector. For example, does NTV have a TB management policy? All of these public places, Parliament, all offices that are bringing people together in the same places should consider this as a high priority disease.
Because it can be spread. It's an airborne disease. So many people are coming in and out. So
KCCA, Ministry of Transport, all of those people, where there is public transport, what is the management policy for tuberculosis?
It's clear that the TB situation is really, really, really bad. Is there anything SIPA Uganda is doing this year?
So this year, SIPA Uganda is going to focus on disseminating our findings, and this is one of our dissemination ports. But also CIPA Uganda is not only going to disseminate findings, we are going to try and come up with programming to address some of the major findings. So emerging findings, for example, are that medicine for tuberculosis is strong. The medicine itself can kill you. And so if your body is weak and you have not had food, it becomes an issue. And it is actually one of the reasons that many people are not completing their treatment.
Oh, wow.
So if we can partner with other organizations to say, how do we make sure that patients who have contracted TB, even if they do not have HIV, are also assisted? Because sometimes people are focusing on people who have both TB and HIV and forgetting that there are TB patients who are not
exclusively.
HIV.
Now, Nora, there's so much information on TB, and I know, so our viewers are interested in knowing more. Is there a toll-free line or a way we can access information from CIPA Uganda? Okay,
CIPA Uganda has established within its website a whole page called tuberculosis.
What's the website?
The website of CIPA is www.cpar Uganda in full, so cparuganda.com. And on that website, on our website, there is a clear page called TB. Tuberculosis.
Oh, well. Since we are running out of time now, if you have just joined us, it's a little bit too late because we are ending the show, but you go to the website of www.cpar, that is CIPA Uganda in full, .com, and get to know more about TB, because the disease is real, it can kill, and it's not only associated with HIV patients, but you can get the disease even if you are a healthy person. And now, you have to test. When you get some coughing, don't think it's just cough. Maybe it could be TB because it's an airborne disease. You could get it anywhere. Now, for more information, go to that website or go to our Facebook page, which is NTV Uganda, and tell us what you think. Do you have information on TB? Share with us, or you can go on to my Facebook page or Twitter, which is Idris Matu, which is EDRISMATU, and tell us more about what you think about the show. Now, tomorrow, we are discussing money. 2018 is a very difficult year. January, they say, has 70 days instead of 30. So you should learn how to spend your money better. Now, tomorrow, catch us same time, same show, and let's talk about money. Good morning.